Why do autoimmune hepatitis flares happen so often? Imagine your body's immune system as a vigilant security guard. In autoimmune hepatitis, this guard mistakenly targets the liver, attacking its cells and causing inflammation. Because this immune response is not fully controlled, it can turn on and off unpredictably, leading to frequent flare-ups. These flares are periods when the immune system becomes more aggressive, worsening liver inflammation and symptoms. One major reason for these recurrent flares is immune system dysregulation. Normally, our immune system learns to recognize our own cells as safe. But in autoimmune hepatitis, this tolerance is lost. The immune system produces autoantibodies and activates immune cells like B and T lymphocytes, which releases inflammatory substances called cytokines. These cytokines cause ongoing inflammation, and since this immune imbalance persists, the disease naturally fluctuates between calmer periods and active flares. Genetics also play a role. Certain genetic markers, especially specific human leukocyte antigen types like HLA-DRB1, O3 and HLA-DRB1, O4, make some people more prone to autoimmune hepatitis. These genetic factors can influence how easily the immune system becomes overactive. Environmental triggers are equally important. Infections such as hepatitis A, B, or C, or viruses like herpes simplex and cytomegalovirus can stimulate immune responses that worsen liver inflammation. Some medications, including drugs like nitrofurantoin or hydralazine, have also been linked to triggering flares. Changes in gut bacteria, which influence immune regulation, can also set off immune activation leading to flare-ups. Stress and hormonal shifts are additional factors. Physical or emotional stress, pregnancy, and postpartum periods can all disturb immune balance, making flares more likely. Diet and changes in intestinal bacteria can influence immune responses too, possibly triggering episodes of increased inflammation. Some autoimmune diseases tend to follow seasonal patterns, with more flares occurring at certain times of the year, likely due to environmental factors or infections. Many patients with autoimmune hepatitis also have other autoimmune conditions, which can complicate immune regulation and increase the risk of flare-ups. Treatment adherence is crucial. If someone stops their immunosuppressive medications or does not follow their prescribed therapy, flares are more likely. About 1 in 5 patients do not reach complete remission with standard treatments, which can leave them vulnerable to recurrent flares. From a liver health perspective, these frequent flares are concerning because repeated inflammation can cause lasting damage. Over time, this can lead to scarring of the liver, known as fibrosis, which can progress to cirrhosis. Cirrhosis significantly raises the risk of developing liver cancer, also called hepatocellular carcinoma. That is why controlling flares through regular monitoring and appropriate medication is essential to protect liver function and prevent long-term complications. In summary, autoimmune hepatitis flares happen often because of a complex mix of genetic predisposition, immune system malfunction, environmental triggers, and treatment factors. These recurrent immune attacks can gradually damage the liver, so managing flares effectively is key to maintaining liver health and reducing the risk of serious conditions like liver cancer. Always consult healthcare professionals for personalized advice and treatment plans tailored to individual needs.